Welcome to the Big Cat Lounge podcast, where we interview guests in a casual lounge setting from all over the world, sharing their insights one story at a time. We can be found on Spotify, YouTube, Apple, iHeartRadio, and much more. Please rate and subscribe to our show to stay updated on the Big Cat Lounge. Thank you so much for tuning in. Welcome to the Big Cat Lounge podcast. I'm Big Cat KZ, and today's guest comes from New York. She is known as the Olivia Pope of home care, offering various certifications in healthcare. In 2013, she launched AllProNYC, a multi-service health services company that specializes in Alzheimer's and dementia, CPR, AED, and first aid trainings and certifications. She is also an ambassador for Jamaica Queens District. She took the skills she excelled at and loved the most to create her company. The core guiding principles are simplicity, professionalism, and out-of-the-box thinking. We welcome Yulandie Latham to the Big Cat Lounge podcast.
Thank you, Kyle, for that great introduction, and happy Saturday to you.
Likewise. Thank you so much for tuning in. So tell me a little bit about your background. I see that you were an alumna at the University of Toronto, where you earned your bachelor's in criminology, and then you made the switch to nursing. So tell me a little bit more about your background.
Well, I grew up in Canada. I was born in England. I grew up in Canada, so I got my first degree from University of Toronto. And a couple of years or shortly after that was completed, I moved to New York. And my mother was in nursing, and I had a sister in nursing. And even though I ended up with a criminology degree, my passion for a good few years was I used to be a systems engineer for Microsoft.
Okay.
So I used to do a lot of testing and setting up of systems, and I was in IT.
Yeah.
And then I would say around when was it? After September 11th, around that time, things in my field kind of went dry for a bit. Jobs were not that much, and what was out there was, there was a lot of competition and not many jobs for a period. And my sister kept on telling me, well, why don't you go into nursing? Why don't you go into nursing? And I said, no, I don't think nursing is for me. It's not something I'd want to do. I can't picture myself in a hospital caring for people. And she said to me, there's a lot that you can do with a nursing degree. It's just like having a high school diploma, but in healthcare. So I decided to look more into it. And I did see that there was a lot of different areas that nurses could excel in. And so I decided to go for it. So I went for an accelerated degree um, in nursing, and it was accelerated because I already had a prior degree. A lot of the prerequisite stuff, I already jumped through all that stuff. So I just had to end up doing a year and a half of nursing school as opposed to doing 4.
Oh, wow.
And so I got into nursing, and it was the best move I ever made in my life. I'm very happy with the experiences and the career journey that I have gone on so far.
Mm-hmm. Yeah, and what made you decide? Because then you were being a nurse, and then now you took the next step and you launched your own company, your multi-service healthcare company. So now you're really giving back. Tell me a little bit more about how you decided to make that next leap to own your own business.
Mm-hmm. So I worked in various nursing areas. I worked when I initially became a nurse. I started working at a great hospital here in the city called Beth Israel Hospital. I worked there on a cardiac floor, and it was it was a floor where they had people who had open heart surgery and other things that happened with their heart. They came to that floor for specialty care. So I worked there for a while, and then I started branching into home care. And I liked home care because it gave me autonomy. It gave me the ability to work my schedule or define my day as I needed to, because I just had to make sure that my clients were taken care of, submit my paperwork. So I loved that work because it gave me the freedom. And a couple years in, there was a manager who I was working for. She was my director. she had, she was working for a company, and she was going on maternity leave, and she said that she wanted to take a couple years off to take care of her child. And she didn't want to do this work anymore. And she was in a director role. And she said, well, Yulandie, why don't you try this? And I said, me? I don't think I could do this. I don't think I want to be tied down. I don't want to be the boss of everything and everybody. I wanted to be able to flit around and flex my time and do the things that I wanted to do. She said, this would be a really great way for you to see things from the management angle, and you can find out if you like it or not. And if you don't like it, you can always go back to what you really like. So I said, okay. So I decided to become a director of patient services for this great company called Allwell. And at the time, it was a small home care agency. And because we were small, I basically had to play every role at some point in the company. So, you know, I was a director, but at times if my scheduler happened to be out, I had to be the scheduler. I had to walk around and convince people to go to work and all these things. I had a lot of different pieces. I was involved in policy creation. I was involved in marketing of the business. I had to really take on all these different hats. Mind you, because I was someone who came in there without the experience of being a manager and a director, I was getting paid less, but the amount of knowledge that I was obtaining from being in this role, that was priceless. So after a while, I got to a point, I said, you know what? My boss is like going to Europe and she's enjoying things. And if I call her with a problem, she says to me, you know, Yulandie, don't call me with the problems, call me with the solution. And I was like, wow. So that's how it is. That's how it is when you're the business owner. She put everything in my hands. I had to do all the running, all the legwork. I was getting paid okay, but not what I should have been for the role. Yeah. After a couple of years of doing this, I started to feel like I was foolish for being in this role because I had so much knowledge, and why am I just sitting here in this role? So I decided to leave, and I left and I went to another company which paid me much, much better. I had a significant jump in salary, and I had a lot of different people on my team to do a lot of the things that I was doing myself, or I had to jump into every now and then. I had a team of people, and that was great for a while too, but it still was not where I wanted to be, because like I said, I got to the point where I figured I have all this knowledge and I know how to do all these things, and I want to be the person who's in Europe calling to check in to see how my business is. So I said, you know, I want to move forward with this. So I had formed my business in 2013, not exactly knowing what I was going to do with it. I knew I wanted to, I needed to involve some form of teaching and education. That was important to me. That's all I knew at 2013. I knew the name and I knew what I wanted to do. How I was going to get there, I had no clue. But as life kind of transformed itself and the years went by, I kind of figured out I have all these really great skills. And now was the time. I felt like I had the confidence and I had the knowledge to take that next step of actually acting on my business. So a couple years later, I would say like, what was it? Maybe 2018, I gave up all of my other jobs and I was no longer a director for anybody. And I said, I need to focus 100% on my business. And I never looked back since. It's been a great experience. I've learned so much. I've gotten so much great opportunities, and my earning potential has gone up tremendously.
And it's just a lot of it has to do with the experiences and the different types of roles that you were exposed to. So you could really get a good holistic view of healthcare in general. Because if you just do one specific role, sometimes you can only see a narrow portion and you're not able to really understand and put the pieces together. But because you're in the ICU, you're a supervisor, care manager, you really, wore different hats and were able to just, produce results and motivate your team.
Exactly. That's exactly where it came in. A lot of the people that I worked with over the years, I'm still friendly with them to this very day. A lot of the companies that I work with, we meet for lunch every now and then. But now our relationship is different because if they need me to do something for them in their business, it's business to business as opposed to me being the employee and they're the employer. So it's been a really it's been a great ride so far, and I have some really exciting new things on the horizon for AllPro.
Oh, yes. Yeah, we're excited to hear what you have in store. So tell me a little bit more
Mhm.
about you went to Capitol Hill to urge Congress to recognize Alzheimer's as a public health crisis. Tell me a little bit more about your journey, and did anything come about it? I mean, any more awareness?
Well, yes. So how I got into doing work for the Alzheimer's Association is of New York when my mother was diagnosed with dementia. And I, not knowing where to turn or how to move forward, like I said, most of my immediate family, they all live in Canada. So I'm the only one that lives here in New York with my family. And I visit often, but I could never be the person who's there to give hands on help or just to be an ear or just to do something, cook, clean, whatever. So
Mhm.
I felt really, really sad about this. And I would wonder to myself, like, what's going to happen when I call my mother and she has no clue who I am? And I would ride the train to work and I would cry about this. I felt really, really bad, you know? Um, so I took that and I started to Google and I found the Alzheimer's Association of New York and I decided to get involved. So at the time when I found them, they were planning a trip to go to Albany to do some lobbying to get more money for research and different things that they were trying to push along with their agenda. Really good connection with the group who was there. A lot of them were people who um, interact a lot with the government agencies and so forth. So they brought me under their wing, and I told my story, and it just ballooned from there. I decided to become an ambassador for my area, and my goal with that relationship was to build a relationship with um, my local politicians here and the ones that represent in Washington to let them know what was happening with Alzheimer's, give them information, let them know that we need their support and so forth. I would attend events and so forth. Um, so it was really, really good for me to become involved in that. So I would start attending these big events. They would have big events in Washington where they would gather people from all across the country to come together to talk about Alzheimer's, to talk about advocacy, to talk about policy change and all of these things. And it just opened a whole new world of people to network with and people who felt as passionate as I did about this cause. And I still do to this day. So, and that basically snowballed last year in 2020. I was nominated for the Carlino Award, which is the award for advocacy work. So I was really, really proud of that.
Yeah. And it's just there's just over 5.8 million Americans living with Alzheimer's today, and it's an ongoing concern, and I don't know if it's a lack of awareness or just lack of resources, because the resources are there, but I don't think we're talking about it nearly enough. So through your organizations that you're part of, you're giving back to the community and trying to bring more awareness, because I don't think it's being talked about.
It's not. And the thing about it is not, I mean, I would say that from the time that I started to get involved in this a few years back, the barometer has moved just a little bit further. I mean, they were trying to push to make Alzheimer's disease a public health crisis. And so there was a push to put out public health announcements. I saw ads in subways and bus sheds and things like this saying that dementia is something that we need to talk about. So that was a step in the right direction. They are getting more additional monies in regards to research and things like that, but it's never enough because this disease is so widespread and it's not a normal thing. There are people who are aging and they're aging gracefully in, way into their late 80s, 90s. They don't have to have dementia and Alzheimer's. The thing about it is that Alzheimer's is not only for old people. Now you have people in their 50s, 60s coming down with this disease. And we really need to address it, because when somebody is completely incapacitated from working and they're in their 50s or so, and they still have families to take care of, they might have kids in college, what happens to these people? What happens to their families? What happens to their kids who were supposed to have dreams of going to college? Now they have to turn around and stay home because somebody has to take care of mom or dad. So this is where I'm at, and like I said, I continue to support this agenda, and I really would like to see a different outcome for people in a few years. Hopefully, I won't have to go down this path.
Yeah. And what do
Mhm.
you say? There's some resources that are available for caregivers, because it's the entire family that goes through the event.
Yes. So, like I said, connecting with an organization
Mhm.
in your neighborhood, like an Alzheimer's Association in your town or in your city, is they become like a huge support for caregivers. Offering additional training, they have like hotlines where they could call to get support. Um, there's a lot of things out there. There's also some really, really great Facebook groups that I belong to, because there's a Facebook group for everything. Just like how there's an app for everything, there
Mhm.
is a Facebook group for everything. If you were to type in dementia and I'm fed up, you can find a group that will talk to you, and you can have people who share your sentiments and you support one another. It's wonderful. It's wonderful. For me, I belong to a couple of these groups. My mother passed away in 2019, but I still like to be in touch with what people are feeling and how they are, what they're going through. And, I offer my support with my comments and stuff like that. When a loved one passes away or someone says that they can't stand their mother or they hate themselves for being in this position, I completely understand. So having those places to vent and express yourself without any judgment, without feeling like people don't understand. At least you know that when you join one of these groups, everybody gets it.
Yeah, it's a support system, and I think that's what a lot of us need is to have, something to fall on as a support system, and to hear stories so we can try and
Mhm.
relate with others.
Right. There's also a really great program here. It's called, what is it called? Consumer Directed Personal Assistant Program, known as the CDPAP. Basically, what that does is, it helps to address the issue of people not getting paid for caregiving. Because, like I said, a lot of people have to give up working because somebody has to stay with mom or dad or auntie or whoever it is,
Mhm.
because they're not able to stay in the household safe. The program, the CDPAP program, allows you to have somebody, a caregiver, care for the person in their home, and they can be a family member and they receive payment for it. So it's not a lot of money. It'd probably be maybe $18, $19 an hour at the most, but at least it comes in handy to help purchase food and things like this, because it can really get
Mhm.
tough if you have no income coming in and you can't go to work. So little programs like that are very, very, well, actually, it's a big program. Big programs like that are very helpful.
Yeah, providing any form of assistance will go a long way.
Hmm.
And so, how has your
Yes.
company been able to pivot during this pandemic? I know there's just so many changes with regulations. We have cutbacks. So, how have you been able to maneuver during this situation?
Mhm. So for me, because of the services that I provide, they never really stopped. In
Yeah.
fact, I've found myself busier than ever, um, in doing the things that need to be done. So, for example, I also do in my one of the things I do is I help people who have home care companies. So, because I spent such a long time in operations and management, upper management in home care, people will come to me to create policies for them. They will come to me to kind of figure out what is the temperature of their company, meaning home care programs are heavy regulated by the Department of Health. There's a lot of rules that you have to follow in order to play the game right. And if you don't play the game the right way, there's some serious fines. They can shut your business down, all of these things. So one of the things that I've been doing is I'll do internal audits for companies, checking out all of their books and how are they processing their patients, how is their HR stuff, because there's very specific things that you must have, and it all has to be within the guidelines that are out there from DOH. So because I know all of this stuff, I have been doing that type of work. I've worked with attorneys on situations where, you know, they have a patient who is receiving health care, and for some reason someone has said that they're getting too much, or somebody doesn't want to pay for something anymore. So they're doing things like independent clinical assessments. That's something that I have done. So my business never really stopped during COVID. I think for me, because I have such a wide variety of things that myself and my team can do, there's just more and more. And it seems like I don't really advertise my business. It's more or less word of mouth.
Mhm.
I haven't really, I don't run commercials or do anything like this, but it's more or less when you do good work, the word spreads on its own. And I'm at that point where I have a lot of different things that are coming to me and my team so that we're always busy. So I'm so grateful for that.
Yeah, and you were able to, document your journey because you've had so many different roles. Then you also had a lot of this knowledge, and then you're able to put it in place with some of the policies and just being a good resource for others because you've had the experience. Not everyone I guess, gets the opportunity to be spread out across, an entire organization, or to get exposed to all the different fields like you were able to.
Wow. I've been fortunate to be able to have those experiences, and I know what I'm good at,
Mhm.
and I know what I can share. I know what I'm an expert at. I know what I'm an all pro at.
You have
Yeah.
a quick quote from yourself to the editor of Forest Hills Time. The ability to think and make decisions about how we choose to live is the hallmark of humanity. Tell me a little bit more about that quote that you'd wrote to the editor of Forest Hills Times.
Oh wow. I don't even. I do remember that. I remember when I wrote that note about. It was a story to do with Alzheimer's.
Yeah, you've written quite so many articles. It's impressive just the amount of work that you've done to give back and to bring light on the subject.
Mhm. Um, yeah, I mean that's the quote basically speaks for itself, and um, I don't know where I even came up with that or where I found that, but it was just something that was so fitting for the article or the story that I was writing at the time. Oh wow.
Yeah, it was very deep, so
Yeah, I
that's
would say
why.
definitely a very, very true statement, because that's where wisdom comes in. And if you can think about what you do before you do it, then all of us would be in such better places, because our instead of basing things on emotional thoughts only, you'd be looking at the whole picture before you take the steps. And if you look and you have the ability to understand your movement before you go, your path to wherever you're going would be more on track, I would say. You'd make less mistakes along the way.
How many of your staff would you say are RNs? Because I know in the industry itself, there's a significant shortage. There's going to be a significant amount of demand, but just being able to retain people, it can be a big challenge. How are you
Mhm.
able to combat some of these?
So on my staff, we're a small group. So we're like a group of 5 nurses right now. And then I have an admin assistant who helps with all the other things that need to be done. So our team is small, and we're very focused, and we're very busy. So this is what has led me to this next part of my business that I'm about to launch, which is a staffing agency. And it's going to be called AllProHealth Staffing. And that, when that happens, which will be, I'm hoping, at least for March, everything will be good to go. The goal is to have a large team of nurses who are out there doing doing nursing for various facilities. So then it just opens up a lot more business to me because there's only so much my team of 5 can do.
Mhm.
And the team of 5 that I have is basically doing all of the things under the consulting piece. So the home care operations, the education, the trainings, all of that stuff. This next piece, which is a staffing piece, is going to be based on staffing RNs, LPNs, and CNAs in medical medical facilities like long-term care facilities, assisted living facilities, hospitals, and so forth.
Mhm.
So
that is
I'm
exciting.
anticipating that there might be a little bit of difficulty because I know that there is a shortage of nurses.
Yeah.
But in the I have run a few ads already, and the response that I'm getting from nurses has been overwhelming. So
Yeah, we're so excited
I'm
to see
feeling.
what you have in store for the future, and just right now, what you told us for your vision. Yeah, it's gonna come. It's gonna come true, and your impact is gonna continue to just expand, and the reach is gonna be there.
Mhm. Thank you, Kyle. I appreciate that.
Well, thank you so much for being you and making your life's work be focused on creating better lives for people. Is there anything else you want to tell our listeners?
All I want to say is if you are thinking about doing a business, stop thinking about it and just do it. A lot of times we over analyze every step that we take, but think about what you're good at and use those skills. Because if you're not sharing your gifts with everybody, you're just being selfish. So share whatever gifts, whatever that you're good at. Think about what you're good at. Think about a business idea, and you don't have to know everything right off the bat. It kind of unfolds as time goes by, but if you're focused and you know this is what you want to do, it will come to fruition.
Today's sponsor is Anchor FM app. Go download the free Anchor app today to get started. You can find it at your Play Store or App Store. It's everything you need to make a podcast, and it distributes everything for you so it can be heard on multiple platforms such as Spotify, Apple, Google Podcasts, and many more. This is what I'm currently using right now to edit and record my podcast, and you can do so from your phone or computer. And the tools are really easy to use to help document the Big Cat Lounge journey. So what are you waiting for? Go today and download it.
Thank you so much. And if everyone wants to follow your journey, where can they look?
So if they want to follow my journey, they're welcome to come on to my LinkedIn page, which is I believe it's Yulandie Latham. I also have an Instagram, and my Instagram is NYC Top RN Trainer. So it's all in one word. NYC Top RN Trainer. And that is where I share pictures of things that I've done and, quotes and different things that I like.
Thank you so much again for coming on the Big Cat Lounge podcast. We appreciate your time.
Thank you, Kyle. Have a good day.
Thank you.
We are accepting applications if you think you have what it takes to be a big cat and be a guest on the show. Email us at bigcatlounge@gmail.com. Thank you for listening to the Big Cat Lounge podcast. Hope to see you soon.